give it a few more seconds. I can see people coming in.
I was hoping the time zone didn't confuse anyone
Yes, that's
with TS
always
and myself in Queensland.
well, 7 p.m. in those celebrating daylight saving, 6 p.m. for those who don't on the East Coast. That should make it 6:30 in South Australia and 4 p.m. in WA. Hopefully everyone can see the welcome schedule, just to give you an idea of what this evening will hold. It has gone 7:01, so I will proceed and introduce everything that's happening. But before we get too much further, I would like to acknowledge and pay respects to our First Nations peoples, past and present, and welcome any Aboriginal or Torres Strait Islander folks joining us this evening. I live on the lands of the Gadigal people of the Eora Nation, but tonight I come to you from the traditional lands of the Kulin Nation, the Wurundjeri, Woiwurrung, and the Boon Wurrung peoples. And I invite you to share in the chat the lands that you're on. Traditional owners have cared for this country upon which we work and meet for over 60,000 years. Its landscapes, sorry, its lands, its oceans, its rivers, its trees, and its wildlife. We endorse the Uluru Statement of the Heart and acknowledge that this land has never been ceded. Our First Nations people have long understood the deeply rooted connection between healthy people, healthy animals, and healthy country. And this ties in really well with the veterinary concept of One Health, an important tenet of our work here at Vets for Climate Action. For those who may not know us yet, Vets for Climate Action is a movement of vets, vet nurses, practices, and industry partners across Australia who care deeply about protecting animals, people, and the environment from the impacts of climate change. We work to inspire and educate both within the veterinary profession and the broader community, promoting sustainability and advocating for strong science-based policy. At Vets for Climate Action, we believe animals need a voice in the climate conversation, and we're proud to be that voice. For those who do not know me, I'm Steph Goldring, and I have the absolute privilege of leading this wonderful group of humans. And I'm very pleased to be able to introduce our newest initiative tonight, which is the Sustainable Equine Series. This series aims to foster engagement, create opportunities for learning, and provide a safe space for open, practical discussion about the real-world challenges and opportunities of embedding environmental sustainability into everyday equine practice. It'll be held every second month, and the online sessions will explore topics such as reviewing and adjusting anaesthetic protocols with sustainability in mind, emerging anthelmintic resistances, sustainability and infection prevention and control, or IPC, dietary transitions towards more sustainable horse feeding, and effective communication around climate and sustainability. The format will differ slightly from our traditional masterclass events for those who are familiar with those. We had one just last week and we've got another one coming up later in the month. Each session of the Sustainable Equine series will begin with a short presentation, followed by an interactive panel discussion designed to encourage questions, shared experience, and honest conversations from equine veterinary teams. So tonight, let me start with a quick introduction. Firstly, to Dr. Caitlin Wood, who is a veterinarian, epidemiologist, and our program director for Sustainable Equine Futures here at Vets for Climate Action. Caitlin works at the intersection of animal health, environmental stewardship, and One Health, helping the equine sector reduce its environmental impact and build a more resilient future for our profession and for the horses we care for. Dr. Caitlin Wood will open this evening with a presentation on the Sustainable Equine Futures program, followed by a panel discussion with our three fantastic guests who I'll leave Caitlin to introduce. Caitlin, over to you.
Thank you, Steph. And I will just share my screen quickly. All right. How does that one look? Wait.
You're all good.
I've just lost my... Oh, did it go away? Sorry. There we go. Okay, so I'll just quickly start. by giving you a quick overview of the three key topics that we have decided to bring to the discussion tonight. So each discussion point is going to be led by an experienced and respected voice within our equine community, and I'm truly honoured that they've all agreed and providing, their time to this special cause. So our first topic will be led by Dr Lidwien-Elisabeth Verdegaal. She's an Equine Internal Medicine Specialist based at the University of Adelaide with a special interest in thermoregulation and heat stress in horses. Our second topic will then be led by Dr Cameron Collins, the very newly appointed Clinical Director at Charles Sturt University Teaching Hospital and the former Managing Director at Scone Equine Hospital. And our third topic will be led by Dr T.S. Merlink, Equine Surgery Specialist and one of the founders of the very newly opened Sunshine Coast Equine Hospital, and also the Warwick Equine Vet Practice. So, one moment. All right. So tonight I am going to be speaking about sustainability in equine vet practice and really provide you with an update of our Sustainable Equine Futures program that we've been working on for the last year. But before I jump into that, I did want to initially take a big picture look at sustainability. This word is quite often thrown around these days, and I really like to start by having a definition there so that we can all be clear we're talking about the same thing. So the definition that I like to return to is that from the United Nations, which defines sustainability as meeting the needs of today without compromising the ability of future generations to meet their needs. And I extend from that to say that in veterinary practice, this means using our resources wisely, minimizing our direct environmental impact, and building resilient businesses and supporting teams that can adapt to future pressures. So to place this concept of sustainability in a global context, we really must first acknowledge a simple truth. We live on a finite planet with finite ecological resources. And one way to understand this is to look at the concept of Earth Overshoot Day. So Earth Overshoot Day represents the point at each calendar year when humanity's demand for ecological resources actually exceeds what the Earth can regenerate in that same year. And last year, I don't know if you can see my pointer here, last year that date fell on the 24th of July. So in the blue in 2025, between January to the 24th of July, humanity consumed as many natural resources as our planet's ecosystem could regenerate in that entire year. From that point onwards, we effectively started drawing down on ecological reserves. We used more arable land, pasture, forests, and fisheries than can be replenished. And we're also emitting more carbon dioxide than our oceans and forests can absorb. So we move into the red. That's our environmental deficit. At our current rate of consumption, humanity would actually require 1.8 Earths to sustainably meet global demand. And if we look at the long-term trend from the 1970s, this date has been moving back and back further and further closer to the front of the year. Now that represents an overconsumption and really also correlates with increasing greenhouse gases. The rate of consumption, as you can see here, is actually not equal geographically over the planet, and that Earth Overshoot Date can be broken down by country. So if we look at it just for Australia, that date moves to March 16th. If everyone on Earth lived like an Australian, we would nearly have reached our annual capacity right now in March, in the first 3 months of our year. Now, central to this ecological overshoot is carbon. The carbon footprint from fossil fuels makes up the largest share of humanity's demand on nature. And as carbon dioxide and other greenhouse gases accumulate, they then drive climate change. We're seeing these consequences in rising temperatures, more frequent and intense weather events, shifting disease patterns, and disruptions to our natural ecosystems. Now, these impacts are not abstract. They are creating real health and welfare consequences for both animals and humans. And this is why sustainability matters. Reducing carbon dioxide emissions directly reduces the pressure that we have put on our planet system, and it strengthens its capacity to sustain life. In fact, according to the Global Footprint Network modelling, if global fossil fuel emissions were able to be reduced by 50%, that Earth overshoot day would actually be shifted back 3 months to late October. That would represent meaningful progress towards living within the ecological limits of our planet. Now, understanding this ecological footprint and sustainability sure makes one thing clear to me. Every sector, including our own, has a role to play in reducing this pressure. So rather than sitting around waiting for change to happen, we asked a pretty simple question. What would meaningful sustainability progress actually look like within the equine sector? And around 12 months ago, the wonderful people you see here joined a equine advisory committee through Vets for Climate Action, and we put our heads together and tried to work out what we could do to help. So from early conversations, the Sustainable Equine Futures program started to take shape. Now that program has the aim to educate and empower the Australian equine sector to make meaningful changes and provide more sustainable veterinary care, reducing carbon emissions, and also promote environmental responsibility across equine veterinary practice, the wider horse community, and industry stakeholders. So even though this program aims to cover the entire equine sector, the logical place to begin is really within equine vet teams. Like human healthcare systems, veterinary practice contributes significantly to resource use, climate pollution, and waste generation. Veterinary teams arguably do understand the One Health concept probably better than most, and yet sustainability is not always embedded in everyday operations, nor in our everyday clinical decision making. So in Australia, I kind of feel like it's still considered really an optional extra. It's something that people kind of put on the back burner until time allows, rather than a core component of what should be best practice. So, the reality is our vet teams sit at the very heart of horse health and welfare. They are trusted professionals and vital conduits between animals, community, and the broader equine industry. So this is where I see real opportunity, right? Equine vet teams are uniquely positioned, not only to reduce their own environmental footprint, but also to model, influence, and lead sustainable practices. So to guide this work moving forward, last year we first wanted to understand what Australian equine vet teams are already doing around sustainability. So we put out a short online survey just to capture a bit of a snapshot of current practices and what people are seeing as barriers related to sustainability in clinic. So it was distributed through email, professional networks, and also conferences. And in total, we had 34 completed surveys received and analysed between April and August 2025. The respondents were actually quite evenly spread across size practices. The mix of equine with small animal, but all with at least equine. And there was an even spread across sole ambulatory vets through to medium and large size hospitals. So the most commonly identified barriers impeding a broader uptake of sustainability initiatives included, well, the most common was the absence of clear industry guidance and standards. And this was followed by a lack of knowledge on sustainable practices, a lack of time and resources, lack of staff engagement, and then it was only last on the list was financial constraints. When asked about existing strategies to reduce their environmental impact, 37% of clinics indicated that they are already doing some kind of either a sustainability strategy, that they have a policy in place, or they do have practices. So the remaining 63% reported that they do not currently implement any formal measures to minimise their environmental impact of their business operation. So this table shows just a quick overview of the specific strategies mentioned by the 13 practices that had stated they are implementing some policies or strategies. These include common things such as reducing paper usage through digital systems, implementing recycle programs, composting organic waste, And some practices mention that they are adopting more sustainable procurement practices, that they might be purposefully reducing fuel usage in ambulatory vehicles and reviewing their anaesthetic protocols to reduce gas emissions from volatile anaesthetic agents. Now, this is probably a good time to mention that although the respondents of our survey were not aware, the governing body, professional body of the AVA does actually have some relevant policies. So it's good to have a quick look at these, because the AVA does promote sustainable practices for veterinarian teams to be able to mitigate human-generated greenhouse gas emissions. They've also added, just last year, 2 more components of a policy, to really highlight the importance of sustainability within ecosystem sustainability and planetary health. So you can find these policies on the AVA website, but it is good for everyone to know, in case they don't, that we do have policies that are trying to create some movement in this space. So the reality that we've been finding is that while many people care deeply about sustainability, and while the AVA does have policies that support it, engaging teams and inspiring meaningful change within busy veterinary practices is still extremely challenging. So in the first year, our project has focused intentionally on clinic engagement. Catherine, Finola and myself have been attending conferences, presenting at clinics, both online and in person, just to start that engagement piece. This year, I will be presenting at the AVA in Brisbane and at Bain Fallon in Melbourne. And we really believe that these engagement pieces are important about getting teams thinking and talking about sustainability. We have the goal to spark curiosity and conversation, because we think that that's really important to get things going. And then we want to inspire teams to take their first steps. We're encouraging progress over perfection, and we talk to clinics about aiming at first just to be sustainable-ish. It's really important to not get too worried about what the perfect ideal of a carbon neutral practice might look like, because that can be a huge roadblock to people. So really just to get the ball rolling and aim to be sustainable-ish, and before they know it, they can work more towards becoming far more sustainable. So over the last 9 months, we have engaged 9 equine-focused veterinary practices in an initial pilot phase. And this pilot phase has been to test our learning resources, provide practical feedback while they're still under development, and really see if the structure that we're creating is going to work in a real-life busy practice. So we are initially asking practices to nominate a climate champion and then build a green team around that. So we are having constant, once a month touch bases with our climate champions, and then disseminating information, structure and support that way. So our early adopters include Westvets at both of their sites, Avenel and Ansted and Marburg, and then of course Scone Equine Group across their 3 sites at Scone, Tamworth and Avenel. So we're also delighted that we now in the second phase of piloting have REC Equine Specialists, Dr Gillian Burns at Veterinary Rehabilitation for Horses, along with Wyong Equine Clinic and Ballarat Vet Practice, all on board for this second phase. So each of these teams who are piloting with us are at very different stages of their sustainability journey, and they all have very different challenges and opportunities. But what I really want to highlight now is just, how wonderful it is they've all been involved at this early stage. I think it's incredible for them to be showing willingness, not just to participate, but it also shows their dedication to help shape and lead sustainability within Australian equine vet teams. And that kind of leadership really matters. Start with these guys and let's see where we are in another year. Very positive about that. Like I said, all the practices start by nominating a climate champion, and then the key resources that they're currently piloting is an online program called the Climate Care Program, Equine Edition. And our focus has really been on developing a framework and practical guidance through the online modules and our direct support with these practices to help the teams assess initially assess, and audit what is their current environmental impact across different areas. Help to identify what some achievable actions might be within their situation, and then implement those meaningful changes within the realities of their busy, busy day. So, just to give you a bit of an idea of what that looks like, to start off with, we are initially guiding clinics through a very basic calculation of their carbon footprint or their carbon hoofprint. And this focuses on what we call GIGV. Shout out to Jeremy. GIGV is a quick acronym concept which covers basically all of your Scope 1 and Scope 2 carbon emissions. It's a nice, simple way for clinics to get involved at actually measuring where their current hotspots are. So GIGV represents grid electricity, isoflurane or other anaesthetic agents, gas from fossil fuel. I must admit, in Queensland and New South Wales, most practices don't have much gas. I think it's all the Victorian states. And then our vehicles, of course. Within equine practice, again, that's going to range hugely depending if you have one car or a fleet of 20 vehicles. So we find, if you make things too complicated, that itself becomes a bigger barrier. People are going to hit the brakes. They put this off for 6 months. 6 months quickly becomes a year. You get the gist. So, by helping them just measure their initial GIGV, we're then providing them an idea of the proportion of where their main Scope 1 and Scope 2 carbon emissions are coming from. The main online climate care program is then focused on 6 practical areas of action where teams can actually take sustainable practices and put them into action. So energy and transport is, of course, one of the largest emission hotspots. Sustainable procurement, recognizing that the purchasing power of vet clinics and choices that we make in our day-to-day actually matter to the environment. Water and waste are 2 areas where simple changes can reduce both environmental impact and also benefit operating costs. We have a One Health in Healthcare module, which explores anaesthetic protocols specifically to reduce greenhouse gas emissions. We highlight on how antimicrobial stewardship and anthelmintic resistances are also a sustainability issue, and look at how chemical use and medication disposal affect the environment. And then finally, we have a module on sustainable management of stable waste, soils and pastures, to really look at where equine facilities have potential to support soil health, reduce methane emissions, and assist with carbon sequestration. So we, like I said, try and provide, an overall roadmap and framework that is going to be simple and manageable for teams. So we try to encourage that they focus on one priority area of action per quarter. You can look at the initial 6 areas of action and be like, yeah, great. But the reality is if you're trying to tackle too many things at once, this is going to lead to going absolutely nowhere. So small, consistent actions build to real change. And we want to encourage teams to, take the time, really focus in on one area at a time and set some achievable goals that you can share and your success with your team. Building that team engagement, sharing your successes more broadly through your community and then with other networks are a really great way of making sure sustainability does become embedded in your team culture and also ideally become one of the values of your practice. So in the end, there are many, many benefits of embedding sustainability into your clinic culture. So whatever your personal driver is, whether it is environmental responsibility, whether it's looking at financials and business, whether it is staff engagement or recruitment and retention, there are a wide number of practical advantages. Sustainability is not just about reducing emissions. It really can improve your efficiency, reduce your costs, and strengthen team morale. So, this is probably the crux of what we're trying to get practices to think about and start to engage in at this stage. And like I said, a part of that component in getting that team engagement is also then putting together different events like this webinar. So this is probably a really good point for me to stop talking and hand over to our actual panel. Catherine, I would love it if you were able to monitor the chat board. I'm not sure who or how many people we have in actual attendance, but if anyone does have any questions or things that they would like to ask or bring up during each separate topic, please pop it into the chat. And then I think what we'll do is at the end of each of these topics, try and pop those questions or have a little bit of a discussion. Please remember, this is the first time we've run this, so we're hoping to iron out any creaks at the next one. So as I have been talking a lot about sustainability and climate, I often focus on mitigation. These are the steps that we take to reduce our emissions, to improve our ecological footprint. But there is another equally important concept along with mitigation, and that is adaptation. So this recognises that changes are already here, and we must prepare our teams and clients for their impacts. So I will take myself off share, and Lidwien, if you are happy to start sharing your screen, we'll move over.
Let me see. Yes, can everybody see my screen?
Yes.
Yes, great. Thank you very much for inviting me. My name is Lidwien Verdegaal, and thank you very much for the first introduction, Caitlin. That was great. And also to set me up for adaptation, what's already happening. My background is, and you can hear my accent, I'm from the Netherlands, where we've been pretty much raised with thinking of the environment. But my experience in hot temperatures only was in the Middle East when I lived in Jordan and in Kuwait before coming to South Australia, where it was also very, very hot temperature. And that then led to my research into thermoregulation. I also came across these bushfire cases during my career. So this is just one slide for me to show you that what I've done. I've used this temperature pill, which is actually traveling through the GI tract, and we measured the thermoregulation in the field. So these are all field data to actually visualize the thermoregulation in horses during different kinds of exercise. And this has set us up really to identify a thermal fingerprint. And so we found that every horse is has a different thermoregulation profile. So that means that we can come up with a general statement of, when it's really hot, we change the temperature of the competition, but we actually have to look at every individual horse. So the rider needs to know their horse when they enter the competition or the racing. So that's something to keep in mind, not to generalize always the preventative measures. To continue from Caitlin's talk, and also from our introduction from yesterday, I'm trying to join the dots, which what are the effects on the equine industry when we think of global warming or climate change. I'm going to talk about exercise, but also the natural disasters and some of the infectious diseases. And I hope to address some reality checks and tips and tricks. So one of those small changes and those examples which we talked about yesterday is, that we know, for example, some of the months are really hot months. And the example would be the 3-day event in Adelaide, which was always classically held in November. And it was hard to change because that's when everybody's focusing on, the 3-day event in Adelaide. And since a few years, this has changed to April. Seems like a simple change, but it obviously has a major effect on the degrees of heat stress cases. And another example I was just thinking of here in South Australia, we have a new racing vet, and she was really, really eminent on changing the racing time to early in the day, which is not always practical, but it does prevent heat stress cases. So why is it important to think of heat stress in exercising horses and also in humans? We have a hot body, then heat stress can develop, which develops into exertional heat illness and exertional heat stroke. Then I always mention this one-liner that the exertional heat stroke is in fact amongst the top 3 causes of sudden death in competing human athletes. And this was only in 2015. So this will increase over time. So we have those cases in humans when they cross the line and they look ataxic and they wobble and then they throw up when they pass the marathon lines. Similarly, we have the collapsing horses due to heat stress in, for example, race horses. So why heat stress matters in exercising horses? It occurs in every season. It's especially in hot climate, but can also occur in the cool climate. It happens both, not only on the track, not only when the horses are competing, but also in stalls and during transport. And mild cases are often missed. So this horse here on the back, this could be a horse with decreased performance due to developing heat stress. And eventually heat stress can kill. And we're mainly thinking of the welfare consequences. So it's often preventable with good management. So timing of the event, we have already discussed. We can schedule the racing much earlier in the day. And also when we train horses, we can acclimatize horses. You can give me a sign, Caitlin, because I'm actually not recording the time and I know I can talk about this subject for ages. So those questions, there are 3 questions, why, or 3 answers actually, to the question why heat stress is reported right now. We know that heat has impact on exercise, on health, and on welfare of horses. So nobody likes to see this collapsing horse, and especially the audience doesn't like to come across those cases. And there's a lot of critique at the moment from the audience on racing incidents and on fatalities. The social license to operate is something already introduced in 2020. So in the media, of course, is also across those cases when racing still occurs. And these are just a few examples of heat stress cases in race horses and the comments of the audience. So secondly, of course, and this fits in this talk tonight, is that climate change does impact the equine industry. And I will talk more about the publication we had in the Equine Veterinary Association last year. So, of course, we have higher temperatures, and this is one of the old graphs, but I really think it shows the what's happening is that the temperature is changing over time, and in red you will see that the temperature is higher than 38 degrees Celsius. So if we look in 2050, most of the countries in the summer months cannot actually schedule competition in horse competitions during that time. Another thing is the heat waves. So that means that horses are not acclimatized to the hot weather. So suddenly the temperature is much hotter. And these are the cases when we have really high risk of exertional heat illness. And then we'll talk about a few of the catastrophic events which happen in Australia and the USA and all over the world with the bushfires and the flooding. So this is a typical case of heat stroke. That those horses collapse, and it can just happen in the desert, like this one in Jordan in the desert. And what I wanted to show with this case is that we managed to cool down this horse. We were kind of really happy that finally this horse rectal temperature went from 43 degrees Celsius to like 39 degrees Celsius. Horse got up. And everybody was like, oh my God, we just probably saved this horse. And then 2 days later, I received the message that the horse developed a very severe laminitis and was eventually euthanized. So what we need to think of when those horses develop heat illness, and even prior to heat stroke, is that lots of the body systems are already affected, and there's a leaky gut and a breakdown of all the body systems. And that's what happened in this case. So even if you don't, so if you cool the horse as soon as possible, this can prevent those. But if it's really a heat stroke, that might be more challenging to occur. And another thing I wanted to address, that those cases which collapse and which severe cases, that's just the top of the iceberg. Most of the cases we actually don't recognize. And we'll talk about this in this slide. So in endurance cases and transportation, heat illness mainly occurs as presents as heat exhaustion. So those horses are dehydrated and become colicky, for example. Whereas in more race horses, our horses, those races are presented with neurological signs. So really severe ataxia post-race or sometimes even prior to the race. And this is similar in humans. Here you see the marathon runners passing the finish and throwing up, also due to GI abnormalities. And this is just to show you that there is recently much more attention and acknowledgement of heat stress cases, and also in cool environments, on a publication in 2023. These are low numbers, but really, I believe this is just the top of the iceberg. And when, for example, Meg Brownlow looked at cases in the hot summer months only, and including all the lower levels of neurological disease, she recorded a prevalence of 9.5%. So this is the paper we published last year, together also with Finola, which is also listening. And really one of the, it was actually initiated by the group of Vets for Climate Change to actually look at what's happening due to climate change. And we called it the riding the storm, adapting equine management to the challenges of climate change. And this we were so happy that it was awarded the best scientific paper. So that meant at least that people read the paper. This was in combination with Oliver Liu, I hope I pronounce this well. He the major experience, and he wrote about his experience with the flooding horses. So one of the two catastrophic events which are more frequently happening due to climate change. So we have the flooding events which we need to be prepared for. We have the severe bushfires, and I will address this in the next slide. We also have to think of different toxicities. So this is a cool, a cute picture of my son riding a pony when I just arrived here in South Australia, and I asked everybody, are the marshmallow, are they actually toxic? And nobody actually thought it would be toxic. But in that paddock, two of the other horses died, and then there was a sort of an outbreak during that time of horses dying due to marshmallow intoxicities. So plants, obviously, there's a lot of drought. Other plants grow and become more and can cause those intoxication outbreaks. So that's something we need to think of during the climate change. And then we have sudden outbreaks of vector-borne diseases, such as the outbreak a few years ago of Japanese encephalitis, which do occur more common due to the increase of the factors with the climate change. So the bushfire cases, I presented it last year at the equine conference in Europe. Was a lot of interest, of course, for it, because we have also the bushfire outbreaks in the US. And this is just an example of a guideline which we produced after reviewing all the cases. So the cases include the cases from the Victoria fires, from the Black Friday fires, and also for some cases from Western Australia. So it's a multi-center study. But we came up with this guideline for management of the burned cases. So if you have this guideline already on your discussed with your practice that when we have cases coming in, these are the steps we're going to take. That means you're prepared for the event to come up. So this is my last slide. I'm not sure how I'm doing with time, but and is okay, Caitlin?
Yeah, perfect.
Yeah. The pictures should be a little bit to the side, but it's really about triage and preparedness. So the first thing is, what is practical, what is achievable? So from all those things that I've just discussed in exercise, also the catastrophic events or infectious diseases, where can we make small changes? And we discussed this also yesterday. We can implement some changes knowing what's happening, so to be prepared. Practice protocols can be part of an induction protocol when we have new staff coming on board. It's good to identify a champion. There's always one person who's very enthusiastic about this subject, for example, but everyone is responsible. That's really important. So while I'm looking at the thermal fingerprint and finding out more details for the exercising horses, I think for the moment we might just implement the cool eventing horses much longer post exercise. And with the other triage, for example, triage is the first aid approach. Be ready for horses when there's heat stress or cooling. Be ready for the disaster. So have that bushfire protocol ready. Have a flooding protocol ready. It can be just already with the telephone numbers, who you're going to call, who's going to do what, and how. What is the first step when we come across those cases? And then adaptation. It's already happening, and we need to be prepared for those effects of the global warming. So that might be that we change the timing of an event, of an equestrian event, longer cooling post exercise. We have those protocols ready. We might also vaccinate those horses. We need to license those vaccines coming into Australia. Prevent vectors, be prepared with biosecurity protocols, and those protocols need to be also discussed within the team. So those are just a few of the simple things. While you know what are the higher risk during the global warming, what are the things you can already implement now and be prepared. Yes, I just thank all the collaborators for the research I've done with them, and especially also the collaborators on the paper which we produced last year.
Thank you so much. That's wonderful. If you're happy to, stop share, I'll get mine back up. Sorry. Let's see. Is that in presenter mode there? Yep. Okay. Yeah, no, thank you very much, Lidwien. That's fantastic. I don't think we had any specific questions, so we will move on to our second topic. Now, while I don't yet have Australian data accurately quantifying the carbon footprint of equine practices, which I would love to have, and maybe we can find a research grant to help me do that. I think it's pretty reasonable for us to expect there's going to be significant variations between clinics. So emission profiles are going to differ hugely depending on your practice setup, your building size, your infrastructure, your fleet vehicles, your caseload, the proportion of surgical referrals. Each different practice is then going to have a little bit of a different profile. However, one thing we can confidently say is that most clinics with a building and a hospital, electricity use derived from fossil fuel power stations is really a major contributor of that practice's ongoing carbon emissions. So I now wanted to turn this topic to quite a practical one and hand over for I guess, more of a discussion as well to Cameron to look at in your experience, and also Tias, I know his experience with his Warwick practice, perhaps we can go between the two of you and have a quick chat about reducing power use from fossil fuels, looking at renewable energy. And Cameron, I will stop talking and hand over to you.
Thanks, Caitlin. Thank you, everybody. I guess we'll jump straight into a hobby horse of mine, if you'll forgive the analogy, and that's solar systems for equine practices. Equine practices are eminently suitable for the use of solar systems for two reasons. One, a lot of the discussion we've been having about sustainable practices, one of the caveats we put on it is this is worthwhile doing and it probably won't cost you much. I think that the data would show that a solar system installed in an equine hospital will save you money. It'll save you between 10 and 40% on your power bills. So, you know, as we know, equine practice has narrow margins, and we're all looking to make our business more profitable. So this is a purely economic decision, as well as everything else, the benefits that come with it. The other reason that equine practices are suitable for a solar system is our time of use is exactly when the energy is being generated. So the small business energy use that an equine practice does is largely during the day, where that's when most of our energy is being produced. We have the roof space. Most of us, unless we're in purely ambulatory practice, and even if we are, we probably have a shed somewhere that we can put a roof on, put a solar system on. And I think, you know, we're obviously an educated audience, so most of our people in the field of equine practice understand the reasons for this and understand the risks to it. So I guess I'd just like to talk a couple of moments about the starting point for this, and I think the starting point is an energy audit for your own practice. So you can Google how to do an energy audit yourself, and if you have a small practice and you have a motivated team, that's often the way to do it from a financial point of view, a conservative financial point of view. But to pick up Caitlin's point earlier, often these things get put on the back burner because we're pretty busy. We've got other things going on. We've got other things that are not urgent, and there's an old principle in equine practice that an expert is someone who comes from somewhere else, basically. So my recommendation would be to find yourself an external consultant. They're easily available. The companies that produce that sell solar systems, obviously they have a vested interest, but most of them are accredited and they're well practiced in assessing your practice and your requirements for energy. So that would be, you know, one of the most practical things I think you can do. You make a commitment to do this, and you make a booking with an energy consultant to come and do an audit. It's not extensive. They need some data from you. They need your power bills, basically. They'll also want to walk through your practice and look at the types of equipment you have, the types of appliances you have. You know, we've all got an old fridge running somewhere in a shed that probably doesn't need to be running. Old fridges, just turning them off makes a decent difference to that. So I think that would be a practical starting point from my point of view that's really worth doing. And then I think understanding the options for financing solar systems. So, you know, the obvious discussion that's been had for 20 or 30 years is the upfront costs are significant, and that's an impediment to people getting started. But I think in veterinary practice, we're used to leasing equipment and looking at a payback period. So, I mean, if you've got the cash sitting in a bottom drawer from people who pay cash, like standardbred clients, for example, you can go out and buy a solar system yourself with that cash. But you could lease the solar system just like you would an X-ray machine or an ultrasound piece of equipment. But there are a couple of other ways that come to mind, and one of the ones that we used when we built the new Scone Equine Hospital was a power purchase agreement. So that's where you use an external company who own and install and maintain all of the equipment on your roof space, and you sign a contract, usually a long-term contract. 10 to 15 years is not unusual, to purchase the power that's generated by your roof space at a particular rate, and that that's obviously open to negotiation, but it's definitely cheaper than what you would buy your electricity from an energy company and you know where it's coming from. So that power purchase agreement is a very worthwhile thing to investigate with a solar company, whichever solar company you choose. There's also solar leasing agreements, which are quite similar. So the external company, the solar supplier, still owns the equipment that sits on your roof. They still maintain it. It's their responsibility to take it away and recycle it. If you don't want it at the end, you have the option to purchase it as well. And in that case, you just pay a monthly fee for electricity. So whatever suits your practice, and that can be calculated during that energy audit. So I think probably throw it open, Caitlin, to anyone who wants to ask any questions, or see if Tias has got any. He's just built a new hospital. See if he's got any comments on
such a great
those funding
overview,
arrangements.
Cameron. That is really fantastic. And Tias, I don't know if you want to add anything, because I was using your Warwick clinic as a great example of being off grid.
Yeah, so just as an example, we have a practice in Warwick for the last 14 years. I made a conscious decision, not necessarily financial, but it has proven to be a good financial decision, never to connect that practice to the grid. So we've had solar and batteries from day one, and we've had to upgrade them a couple of times as the practice grows. We have had to use a diesel backup generator because the nature of the business is if something needs to be done, it needs to be done immediately. But having said that, we've got two backup diesel generators, but together they've only run 1,000 hours in 14 years. So a very small amount of time considering the amount of power we've generated. So in that entire time, we've had no power bills. And it's just been a little contribution to reducing. But that's the reason we did it. I did it is that I just wanted to. And on my farm, this practice is on a farm I have. 20 years ago, we built a house there, and again, never connected it to the grid. So we've been completely off grid on this property since inception. That's just an example of what can be done.
I think it's a great note there, Tias, as well. If I can add in, it reduces emissions, it is cost beneficial, but also it then builds that resilience for future uncertainties. I mean, I don't know about your area, but I had 25 power outages last year. Now, I'm not running a hospital from my home, but it does mean you need to make sure you've got your backups there, your generator, so that you can have electricity when you need it. So I guess that's another element there, is that you've got power all the time.
Certainly, it has been incredibly more reliable than being connected to the grid. We've just built a hospital on the Sunshine Coast, and it's connected to the grid currently because we just couldn't afford the upfront capital cost. But the first thing we had to do was install a large diesel backup generator because of the uncertainty of the power supply. So it's been a great initiative for our practice. It's probably financially been beneficial in the long term. And the other important thing, another real reason why we did it in Warwick was because we wanted to demonstrate to our clients that it was possible. And I couldn't tell you how many clients, businesses and farms have observed that we're not connected to the grid and gone on to do similar things. And I think that's always an important aspect as well.
Amazing. That's great. I am going to move us on, if that's okay, because I've just realized the time. So let me see. Have I stopped sharing there? And I just put up, one of the sustainable energy strategies that we have put together in our learning modules. So finally, I wanted to turn to something a little bit, more tangible, I guess, we're talking about emissions and we talk about power and electricity, and they're all very invisible elements. Whereas something that is a little bit more visible and probably kind of sticks a real point into the side of everyone in everyday practice is looking at surgical waste. I do know that we don't have a huge amount of time here, but I think it would be great, Tias, if you are happy. I'll
Yes.
share my screen again. I have too many tabs open. And then if anyone does have any questions, this topic came up because I have been doing so much reading and research, in ways practices can make better decisions, and everywhere states to look at using, where you can, reusable surgical drapes, reusable gowns, not using the single-use plastic ones. But it's very easy, or scary actually, for me, not running a hospital or a surgery, to be giving that advice to people. So I did want to put it over to a surgeon, a little bit to look at, what are you doing in practice? Is this obviously an issue that's on your mind as well, someone who thinks about sustainability a lot? So I'll hand over to you, Tias.
Thank you, Caitlin. Yes, it's an important point. I think a lot of the carbon footprint, a lot of the waste generated by practice is actually in the operating room. And there's these checklists, and we have very little time left. So,
We do.
but there is an incredible amount of information that's very quick to access. Just preparing for this, it took me no time to become much more informed than I was before. And there's this list, this checklist that you can get through this organisation. And I thought I'd just pick out a few. And Caitlin is right. The drapes is an obvious one. Now, there's plenty of good evidence that using renewable drapes and renewable gowns has a significantly reduced carbon footprint or environmental footprint than the disposable ones. And there's been a trend, and there will be commercial pressures for this as well, but there's been a trend to using disposable drapes, and that's seen as the gold standard. But the evidence clearly does not support this. If you go read the literature, the metric that we're measuring, the surgical site infections or other surgical complications, is not reduced by using, in the most cases, these disposable drapes. So that's an important point. So that if we go from using traditionally, when I started in practice, we very rarely used disposable drapes or disposable gowns. Now it's the norm. But the evidence does not support that. So it's one easy way we can use to reduce our environmental impact. I've got the figures here in front of me, but it's just markedly less. So we in our practice will use renewable drapes as much as reasonably possible. Equine surgery, and we're really short on time, there are some procedures which have high levels of fluid use, high levels of contamination. And there's some cases where I believe that the use of disposable drapes is still warranted. But in the vast majority of cases, we probably don't need to. And so some combination of the two is where we sit in our practice. The other obvious place when we're talking about drapes and gowns is our instrument wrapping. Using renewable boxes, instrument boxes, is both economically sensible and environmentally advantageous. You tell me when I need to stop, Caitlin. And the other, just going very quickly through it. So the other big thing, and I know you're going to have a webinar on it, I heard that just before, but the other thing that we in our space in the operating room, the other big environmental impact that we can work on and I've only recently really become aware of it, is the use of volatile anesthetics, carbon dioxide and nitrous oxide, so that's a topic for another day, but I think we all need to be aware of that as well.
Absolutely. No, thank you so much, Tias. We actually had Neil Walton, who's here tonight, and he's on our advisory panel, do a presentation last week, which was based across small animals as well. And we are going to be holding another webinar specific to equine, because the reality is equine anesthetics are so high risk anyway. They have so many additional elements to consider and think about. They really do need their own, I think, space to discuss. And we're hoping to have Colin Dunlop jump back on for that one. And even we're reaching out to Tim Mayer from Bell Equine Practice in the UK, because they've been trialing and using the SAGE gas capture system. So yeah, this is certainly something on the cards for us. We are running short of time, everyone. So what I'll probably do is just quickly pop up an acknowledgement of our partners. Catherine, did I miss any questions? Too many screens open. I couldn't see what was happening.
No, Caitlin, you're all good.
Excellent. So I might as well just leave this slide up. If anyone listening or watching this does want to get involved with the Sustainable Equine Futures, this QR code at this stage is just going to send you to join the Vets for Climate Action newsletter. We don't have a specific Sustainable Equine Futures newsletter. We have limited resources, a lot of people volunteering their time, and if anybody else from Equine Practice is looking at this and going, oh, I'd love to get involved, reach out. We are a nice team that is really wanting to keep this a dynamic space. It is an evolving space, so new information is constantly coming to light, and not only information but opportunities. We didn't get to talk about government grants, but there are a lot of government grants that will continue to be popping up, and being savvy and looking at if there's one that suits your practice to be able to implement some changes, put in EV charging stations, even just switch over your lighting to some more energy efficient lighting. These things exist, and so we're here hoping to share that information with everyone. That's me, Catherine.
All good. Thanks, Caitlin. And thank you very much to our panel for contributing their time. Cheers, Cameron and Lidwien. Thank you so much for giving up your time this evening. Lots of food for thought. I think it's really important to keep having these discussions. Everybody has something to offer in this space, and I think that it's important that we just keep opening it up and getting people thinking about sustainability as just being part of normal operating procedures. So thanks, everyone. We'll be doing more of these, and we look forward to seeing you all again.
Thank you.
Thanks,
Thank
Caitlin.
you.
Great work.
Thanks.